Good morning. Well, according to health officials, the research is alarming. The study predicts that if we don't start making changes now, then more than 500,000 of our children will have diabetes by the year 2060. Take a look here. Researchers project a 700% increase in type 2 diabetes and a 65% increase in type 1 diabetes in children in the next 40 years. Now, that same study found that people of color are more likely to develop type 2 diabetes than white Americans. That huge increase, especially in communities more likely to lack medical care, which could be a disaster to an already strained healthcare system. Now, several factors attribute to a rise in diabetes, but medical experts say one way to flatten the curve is to try to reduce obesity in our children, and that is to teach them healthy lifestyle changes. Mitch, Adrienne.
All right, Kelsey, thank you so much. We are joined right now by Dr. Eliza Holland, a pediatrician at UVA Children's Hospital in Charlottesville. Thanks for being with us. What is behind these latest numbers for kids and teens, this projected surge?
So obesity has been on the rise over the last several years, and we saw a definite worsening of obesity in children during COVID. And this was multifactorial. Children didn't have as much access to activities. As you remember, in many places, playgrounds were closed. Children were not encouraged to be outside. There was also a lot of stress in the households, irregular eating time, more time on screens. And all of this led to an increase in weight in our children.
There was, of course, the pandemic, and there was a study last year that said COVID-19 survivors are 40% more likely to be diagnosed with diabetes a year after recovering. Do we know the link between these two illnesses?
So I'm not quite sure which study you're referring to. There was a study that was published by the CDC a couple of years, I think last year, and they didn't distinguish between type 1 and type 2 diabetes. So type 1 diabetes, just to break this down real quick, is autoimmune. Your body is fighting against itself. And in that fight, the body can't produce insulin, which it needs to break down the glucose. Type 2 diabetes is related most often to weight. There is some genetic component. And in type 2 diabetes, the insulin is produced, but your body can't process it, so your sugars are high. And what other studies have found is that type 2 diabetes increased during COVID, and so far they haven't found a lot of links between COVID and type 1 diabetes.
And this was from a National Institute of Health report in terms of the link. But obviously, if you are obese or you have a weight issue, there are a number of different diseases that you might be more susceptible to. And childhood obesity is something that we're paying even more close attention to. What do parents need to know? What should they do in light of these numbers?
So it's obviously a big problem, and you're not going to be able to fix everything at once. So I tell families to break it down into simple steps. Easy things to do. Swap out sweetened drinks such as juices, sodas, Gatorade for water, or maybe just a splash of juice in water to give it some flavor. If you think about a can of Coke has 140 calories in it. So 1 or 2 of those a day can really start to add up. Gatorade is also high in calories, as are juices. Make sure your children are getting at least 60 minutes of exercise a day. That doesn't have to be 60 minutes all at once. That can be 10 minutes walking the dog 3 times a day, and then maybe some jumping rope or running around in the yard.
Go play outside. What a novel idea for children.
Play outside. And I realize in some neighborhoods that's really hard. It's not safe to play outside. So I think as a larger community, we really need to advocate for safe spaces for our children to play.
Yeah.
And where they can be outside. We need to be pushing for more PE time in schools. PE is often being cut for other instruction, but it's so important for our kids to be moving, not just for their weight, but it also helps them concentrate and to learn really important skills playing with their friends.
Yeah, absolutely. Socialization is a huge part of health. Thank you, Dr. Eliza Holland, and great points that you made about safe spaces. We appreciate it.
Thank you so much. Happy New Year.
Happy New Year.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.